guys, this is Dr. Ip at Vibrant Dermatology. So anyone who follows me on Instagram knows how much I love microneedling. It's one of my favorite treatments because of its versatility. And today we're going to do a video about microneedling and PRP for melasma. So this is my beautiful patient, and she's been struggling with melasma for several years. I want to start off by explaining what melasma is. So melasma is a mask-like hyperpigmentation of the face that is more common in women because it's stimulated by estrogen. Sometimes it's called the mask of pregnancy because some women get flares when they're pregnant. Melasma can also be stimulated by hormonal birth control as well. So one of the difficulties about melasma is that it's really difficult to treat. And our patient has gone through a number of different treatments before she started to have results, with me of course. And some of those treatments included chemical peels. She tried topical hydroquinone products as well as some laser. So up until this point we've been doing, we're going to go to the other side. We've been doing microneedling with a medication called Tranexamic Acid. And Tranexamic Acid helps to prevent sun-induced hyperpigmentation. And she's gotten improvement in her melasma from this. And so we kind of hit a wall a little bit. It's similar to anything that takes a lot of time and dedication. Sometimes you get a plateau. And so she started to feel like the little bit of melasma that she had left wasn't going anywhere. So we decided to do microneedling with PRP. Now, PRP stands for Platelet Rich Plasma, and what I did before we started this was draw her blood, and then we get this liquid gold. See, that doesn't look red anymore, does it? And that is the platelets, and the platelets have growth factors and stem cells in them. And those growth factors and stem cells facilitate skin healing. Now we use PRP for a number of different things as well. We use this for hair loss. We use this for anti-aging. I use this for acne scarring. And in this instance, we're using it to address melasma. I have these skipped a little bit. I'm going to put a little bit more. So I am, may I have a gauze, please? If you can imagine, PRP can be a little drippy. So I am actually microneedling the PRP into these areas where she has the melasma. And then I'm also going to inject it intradermally. Okay? So we're going to go to the forehead now. So what I'm going to do, I'm going to finish up on this part a little more. And then we'll start the video again when I am injecting it intradermally so that you can see how that part is done. Alright, so I just finished microneedling her entire face and pouring this liquid gold PRP onto her skin. When you look at studies about the use of PRP for melasma, PRP can be used kind of topically, as I'm doing now, where we use the microneedling to really allow drug delivery. And then PRP has also been studied using it intradermally. So that's what I'm going to do now. What I'm going to do is make some tiny little blebs. I will admit that this part may hurt a little bit, of course, because I am using a needle. So I am just injecting little blebs in the dermis, in the areas that she has her melasma. This is also actually going to do wonders for her skin from an anti-aging perspective. I know that you're going to ask, does this hurt? Yeah. Hurts a little bit, but she has been numb for several minutes, which is helping with that discomfort. All right, so we inject it into that side there. Then I'm going to turn this cheek, and you can see a little bit of brown there. So we're going to go and inject intradermally here. My patient is awesome. She's a yogi, so she is like perfectly calm. I would be lying if we said that everyone is as calm when I do this. But she's remarkable. Alright, so injecting this PRP in all the places where we have a little bit of melasma. Okay, Excellent. So now we have that intradermally as well. Because, you know, I'm the anti-aging doc, I'm going to go and put some PRP in some of her fine lines here because that will help to address the volume loss. And then I'm going to put a little bit in the fine lines here as well. Just nasal labial fold, which will help. It's like your body's own filler because it stimulates collagen. Okay? Alright, so I am going to finish this part of the treatment and I'll come back and show you the very last part. So we're entering into the last part of this treatment here. So the first step we did was cleanse the skin, we drew blood, we got PRP, and then I microneedled the PRP into her skin. Then I injected PRP into her skin. And now we're going to do this last part, which is Tranexamic Acid. Tranexamic Acid, as I told you, helps to prevent sun-induced hyperpigmentation. So I'm putting that right over the areas that have the melasma. And this is getting into her skin because we did the microneedling. So there are those tiny holes that the microneedling has put there so that we can deliver this drug to her skin. All right. So after all of that, we're going to put a relaxing mask on her skin. The masks are awesome because they smell like a little piece of heaven. So we'll put that mask on and she will sit here for about 10 more minutes. And the mask is a hydrocolloid mask made by hydropeptide. And that is going to help all of the things that I put into her skin get absorbed more effectively. It's also going to calm the redness that you see from the microneedling. She's a tiny little face, so I need to arrange this appropriately here. They smell good, they feel good. Help induce a little bit of relaxation after all of that. And then, if she allows us, we'll share her before and afters for this treatment. But she's already had great improvement and we're just trying to shoot for perfection. All right, so if you have any questions about melasma, microneedling, or PRP, feel free to call our office. Until next time.